Hello and welcome to Chapter 6, Anatomy and Physiology for the EMT. Again, this is like Chapter 5. It's meant to just be a short overview of the chapter. It's not meant to go into depth. Hopefully, you've done your crash course anatomy, and that will give you a much broader depth of anatomy and physiology. And it will give you a deeper knowledge of it. So we'll get into it. We're just going to talk about the body systems today. Okay. So there's three main functions for the musculoskeletal system. It gives the body shape, it protects vital internal organs, and it provides for body movement. Without this, you'd just be a puddle of mush on the ground. Okay. The skeleton, it consists of the skull, the spine, the ribs, sternum, shoulders, upper extremities, pelvis, and lower extremities. Pretty much anywhere you got a bone is what the skeleton consists of. Okay. The skull is that bony structure of the head. Its function is to enclose and protect the brain. You've got the cranium, which has a top, back, and sides. The face, which is up here, is the front of the skull, and it gives your face shape. Okay. So the skull, it connects to the facial bones. You've got the mandible, the maxilla, the nasal bones, the orbital bones, and the zygomatic arches, which are your cheekbones right up here. So again, this is a picture of the skull. So we've got different bones inside the skull. So you've got your parietal bone, which is this right here. These little squiggly lines are fissures in the skull and they're fused bones together. So you've got your parietal bone, your temporal bone, your occipital bone. Okay, your mandible is your jawbone. Your maxilla is your upper lip. You've got your orbital bone, your nasal bone, your lacrimal bone, which is kind of on the inside of your eye, and then your frontal bone up here. Okay, in the spinal column there are 33 vertebrae. It's essential for movement, sensation, and vital functions. So that spinal column protects the spinal cord, which goes to your brain. Okay, so the brain is the powerhouse. It's, it basically tells the body what to do, and how it does that is it goes through the spinal cord. And in the spinal cord, you've got all of your nerves, baroreceptors, chemoreceptors, everything in that spinal cord that basically tells the brain all about the functions and everything that goes back up into the brain. Your thorax is your chest cavity, and it contains the heart, the lungs, and major blood vessels like your aorta, your ascending aorta, your descending aorta, and it contains all of that. Okay. So this is your spinal column. All right. So you've got your cervical spine, which is 1 through 7. You've got thoracic spine 1 through 12, lumbar spine 1 through 5. You've got your sacrum and your coccyx. Okay, in your pelvis, you've got your ilium, your ischium, your pubis, your hip joint, which includes your acetabellum, which is the head of the femur, and then the ball at the proximal end of the femur. In your lower extremities, you have your femur, which is the big, huge, long bone in your thigh. You've got your patella, which is the kneecap, the tibia, and the fibula, which are both the lower leg. You've got 2 bones down there. And then you've got your ankle, the big, huge knots on either side of the ankle. On the outside, you've got your lateral malleolus, and your medial malleolus is on the inside. In your foot, You have your metatarsals, which are the bigger bones of the foot. You've got your calcaneus, which is the heel of the foot, and then phalanges, which are the toe bones. Okay. In your upper extremities, you've got your clavicle, which is that bone that runs across the chest over to the shoulder. You've got your scapula, your acromion process, your humerus, your radius, and ulna, which are both in the lower arm. Okay, at the wrist you've got your carpals. So if you look here, all of this right here is technically the wrist, right here. So you've got carpals in here, and then in your hand, all of this right here on the palm of your hand, at the back of your hand before you hit the fingers, is your metacarpals, and then you go into your phalanges, which are your finger bones. Okay, this is just a visual representation of the skeleton. So joints, they're formed when bones connect to other bones, and you've got two types of joints, which are ball and socket and hinge. So a ball and socket is just that ball, and it rotates and goes around, and then the hinge is that hinge joint where all it does is move up and down or side to side. It does not go it does not have full range of motion. Okay. So you've got muscles, which you've got voluntary muscles, which are your skeletal muscles, and then you've got involuntary muscle, which is your smooth muscle, and then you've got cardiac muscle. And your cardiac muscle has automaticity, which gives the ability, the heart the ability to generate and conduct its own electrical impulses. Okay, so skeletal muscle is all of this rough, striated muscle that you see here. Smooth muscle is in like the lungs, the organs that have muscle, and your abdomen as well. Okay, so the respiratory system. This brings in oxygen via inhalation and excretes carbon dioxide via exhalation. So air enters the body through the mouth and nose. It moves through to the oropharynx and the nasopharynx, okay, and then it moves into towards the lungs. It over the epiglottis, which closes over the glottis, preventing air from going into the stomach. Okay. The larynx, which is your voice box, it contains two white muscles that are called vocal cords. Okay, they're white. They look like a V when you look at it. And then you've got your cricoid cartilage, which forms the lower portion of the larynx, and it goes into the trachea. And then your air goes into the lungs, the bronchi, the alveoli, and then the diaphragm. Okay, so the diaphragm helps to move, expand the chest and contract the chest for breathing. Yeah, and then your alveoli, essentially what they do is when the air gets into those little sacs, which is basically what they are, sacs, they then do the exchange. There's a capillary bed that surrounds that sac, and it does the exchange with the blood, giving it oxygen and taking out the carbon dioxide. Okay, so inhalation is an active process. It involves the diaphragm and intercostal muscles that contract. The diaphragm moves downward and the ribs move upward and outward, allowing the air to, or the chest to expand. And what it does is it also creates negative pressure, and it pulls air into the lungs. Exhalation is a passive process, and all of those muscles that we just contracted now relax, and contract the chest to be smaller, and it consists of a positive pressure, so it pushes that air out of the lungs. Okay, so ventilation. So there's a difference between mechanical ventilation and cellular ventilation or respiration. Okay, the words are sometimes interchangeable, but when you talk about respiration and inhalation, exhalation, and all of that, you need to really kind of differentiate what you're talking about. So ventilation is the movement of gases to and from the alveoli. So that's your inhalation, that's your respiration, your mechanical respiration. So cellular respiration is that respiration that occurs and it exchanges those gases between the cells and the bloodstream. Okay, oxygenated blood is carried from the lungs to the heart and then is pumped to the rest of the body. At the cellular level, oxygen is exchanged with cells for waste carbon dioxide. This is that cellular respiration. And deoxygenated blood returns to the heart, then to the lungs to exchange it for carbon dioxide for oxygen. Okay, so when we look at children and adults, children have a smaller nose and mouth, and there's more space in the mouth that is taken up by the tongue. It may not be bigger than an adult's, but the fact that they have a smaller mouth and their tongue is proportionally larger than an adult's. It's not necessarily that it is bigger, it's just proportionally to the mouth it is bigger. Okay, their trachea is narrower. Their cricoid cartilage, which is all this cartilage right here in the trachea. Okay, so these white spaces in between the blue are all cartilage, and it's less rigid and less developed. And then airway structures are more easily obstructed in children as well. So the cardiovascular system, you've got your heart, your blood, and your blood vessels. Okay, so in the heart, we've got 4 chambers. There's 2 atria, which are the upper areas, and 2 ventricles, which are the lower areas. The path of blood through the heart, it goes from the right atrium to the right ventricle, to the left atrium, and then down to the left ventricle. Okay, so again, what happens, let's say that we're coming back from the big toe. So we come up from the body right here, so toe. That blood that got exchanged for carbon dioxide comes up to the inferior vena cava, and what it does is it goes into the right atrium right here. Okay, so this is where it starts its journey into the heart. It goes through the tricuspid valve right here and into the right ventricle. From the right ventricle, it goes into the pulmonary valve, goes through the pulmonary valve, and out to the lungs. Okay, out to the lungs. So once it goes into it either goes into the left pulmonary artery or the right, so the left lung or the right lung, and it gets exchanged out here for CO2 to oxygen. Okay, and then once it gets exchanged, it comes back from the lungs, okay, here, into your pulmonary veins, and then it goes into the left atrium through the mitral or bicuspid valve, okay, and then it goes into the left ventricle right here, and then it goes up into the aorta. So this is your ascending aorta, okay, and the blood either goes to the brain up through these arteries, or it goes down here. Okay, so follow it down here, back behind the heart, and then back to the big toe. Okay, so it takes a journey. It happens within seconds. It does not take very long for all of this to occur. If you think about it, one beat from the heart is one cycle of the entire process. Okay, so your heart beats an average of 60 to 100 beats per minute. Each cycle, you're doing about 60 to 100 of those each minute. Okay, so the cardiac conduction system. So the heart has this cardiac conduction system, and when we look in here, we've got our SA node is where it starts. Okay, the brain says, hey, the heart says, hey, I need to beat. So what it does is the SA node is that pacemaker, and it sets the pace for the rest of the heart. The SA node starts, and it goes into the AV node, or the atrioventricular node. Okay? It then goes into the AV bundle, or the bundle of His, okay, right here. And then from here, it splits off into the bundle branches. Okay, so right bundle branch, left bundle branch. Remember, this is our left ventricle. This is our right atrium, just for reference. So it goes from here into your bundle branches, and then from here it goes into our Purkinje fibers. Okay, and it makes the heart pump. All right, so if there is a problem, and then of course this goes over here. So if there is a problem, let's say AFib is a big one. So atrial fibrillation is where the heart quivers, the top of the heart quivers, and it didn't get set off right. Okay, so we know a lot of people who have AFib. We probably know somebody who has AFib, or the atrial fibrillation. We know somebody who lives with it. Okay, you can live with AFib. It's not a bad thing if it's treated. Okay, so when AFib is not treated, or it goes uncontrolled, is when it becomes a problem. But most people, I made a smiley face apparently. Most people can live with AFib controlled, not a problem. So when we look at AFib, what happens is this node, this SA node, okay, all it does is sit up here and it quivers. And it doesn't do what it needs to do. Okay? It does not fire off the way it needs to fire off. There's something wrong with it. So all it does is just kind of sit there and just quiver all the time. All right? What happens is when that message gets sent down to this AV node right here, the AV node says, hey, you need to chill out and fix yourself, because I'm going to fix this for us, for the heart. I'm going to fix it for us. You just chill out and quiver and be all anxious. So the AV node says, hey, you didn't do something right. I'm going to fix it. And then it resets that pulse, and it sends the correct pulse into the rest of the system. Okay, so it sends it to the bundle of His, and then down through the right bundle branches and the left bundle branch, and then to the Purkinje fibers and all of that. So it sends the correct pulse, and you'll see it on an ECG. they won't have a P wave, and their line will just kind of quiver. And we'll talk about that more when we get into cardiology. Just slightly, not much. And then sometimes if a patient goes into cardiac arrest, we call one of those rhythms ventricular fibrillation. What happens in ventricular fibrillation is the atria says, hey, I'm good. We're chilling. I'm going to send you a pulse, and you're all good. The AV node says, oh no, that's not going to happen. I can't do that. You're just way too chill, and we're gonna party it out. So the AV node now quivers. Okay, so it just sits there and quivers and quivers and quivers, and that is a lethal rhythm. It has to be shocked right away so that they can be reset. That heart has to get reset as soon as possible. Otherwise, your patient's not going to live. Okay? So, again, we'll go into it a little bit more when we get into cardiology. Not much. We'll talk about it. We'll skim over it. And I'll show you QRSs and ECGs. So, all right. Circulation of the blood. So it's important to know that the heart has coronary arteries that supply blood to the heart. All right. And then the aorta, the pulmonary arteries, the carotid arteries, and the femoral arteries. So you've got your brachial artery, radial, posterior tibial, your dorsalis pedis arteries. Okay, so these are all arteries that you pretty much need to know where they are. Okay. All right. So arteries, capillaries, and veins. So remember back to that one slide where I was showing you how the blood flow went through the heart. Okay, so when it goes up into the aorta and it goes down to the descending aorta behind the heart, and then it goes into the abdominal aorta, what happens is at the abdominal aorta, it then splits off into arteries. They're bigger vessels. They're not quite as big as the aorta, but they're bigger vessels that are bigger than the arterioles. Okay, so let's think about this in a more matter-of-fact way. So you've got your highways and byways and interstates. Okay, so your interstates are big. They are typically 4 lanes, and they control traffic one way and the other way. So let's think about it that way. So you've got your aorta, which is an interstate. Okay, so it can handle a lot of traffic. All right. Then you've got your artery, which is like a highway. Okay, so it comes off of those arteries, the aorta. Okay, so the highways then come off of the interstate, and then you go into like your county roads or your gravel roads, which are your arterioles. Okay, and then you get into a driveway, and that's your capillary bed. Okay, so that driveway is where all of that gets exchanged. You've got carbon dioxide that gets exchanged for oxygen. You've got chemicals that get exchanged. You've got various things. You've got baroreceptors that read the pressure in all of those arteries and all of those arterioles. You've got chemoreceptors that say, hey, I've got too much of this type of something in here, so we need to get rid of it. So then those arteries and those arterioles and all of that, they all exchange and take up all of that waste and stuff, and it takes it to where it needs to go. So it either takes it to the liver, where medicine gets broken down and gets distributed to the body, or it then takes it to the heart or to wherever that chemical needs to go or that waste needs to go. So like the kidneys, okay? Takes it to the kidneys, it gets filtered out through the kidneys, and it becomes waste as urine. All right. So again, so we're talking about interstates, highways, gravel roads, and driveways. So once you get into your driveway, you probably take all of your groceries inside, blah, blah, blah. So let's say that your trash needs to be taken out, okay? But you don't have a trash can at home. You've got to take it somewhere else, far away, okay? So you take out the trash that you've exchanged for clean groceries and clean stuff. So you take out your trash, and that trash goes into your car, okay, and out into your driveway, so your capillary bed. And then once it goes from your capillary bed, it goes up into the gravel road that you have to drive down to get there, okay? And then just say we're taking a different gravel road, okay, out. So we're going to take a different gravel road out, and then we take a different highway than we did before coming down. So now we're on that highway, and then we're going to go out to the interstate. That interstate is going to take us back up to where we need to go to jump off this trash. Okay, so that trash goes through the heart, and then it goes to the lungs to be exhaled CO2 or carbon dioxide. Okay, so I hope that makes sense. If it doesn't, you can hit me up and I'll try and explain it a different way. So composition of the blood. So we've got plasma, red blood cells, white blood cells, and platelets. So plasma is more than half of the volume of the blood. Plasma is the liquid form of the blood. Okay. So then you've got red blood cells just kind of floating around in that blood. You've got white blood cells floating around in that blood too. Okay. And then you've got platelets. Platelets help with clotting. All right. So pulse. Pulse is the pressure wave of blood flowing down an artery when the left ventricle contracts. It can be felt by compressing an artery over a bone. So you've got peripheral pulses, which are the outer parts of the body, so radial, brachial, posterior tibial, and dorsalis pedis. And then you've got central pulses, which are at the core of the body, and you've got your carotid and femoral. So central pulses can be felt when the peripheral pulses are too weak to be felt. So blood pressure is the force of blood exerted against the walls of the blood vessels. Systolic is your upper reading, which is an arterial pressure when the left ventricle contracts and pushes that blood out. The diastolic, or the lower reading, is the pressure when that ventricle relaxes and it allows blood to fill from the left atrium. Okay, all of that oxygenated blood that came from the lungs into the left atrium is now into the left ventricle, and it's relaxed, it's getting there, and then it forces that blood out. Okay, so let's think about the fact that a pulse is the electrical system, okay, and the blood pressure is the plumbing. All right, so you've got your plumbing, which are all the vessels and everything that the fluid runs through, the blood runs through, and then you've got your electrical system, and you need, electricity to pump the heart. So pulse is electricity. That good bounding pulse is great. It helps us to identify various things, as does the blood pressure. But they are two different things. Okay, so the pulse does the electrical side of the heart, and the blood pressure does the plumbing side of the heart. Let's talk about perfusion. So what is perfusion? It's the adequate circulation of blood and exchange of oxygen and waste products. Hypoperfusion, or shock, this is when the flow becomes inadequate for some reason. Okay, so we've either got typically you've got some type of plumbing problem. Okay, the vessels become too big, and there's not enough fluid to fill those vessels, and you become hypoperfused, okay? Or they become too small, and you've got too much fluid trying to push its way through those vessels. All right, so let's think about this. How is the function of the respiratory system related to the function of the circulatory system? So you have to have oxygen, okay, to be able to oxygenate the blood, to give the blood the proper oxygenation. If you don't have that, then you don't have anything. So the respiratory system and the circulatory system work together to be able to provide that oxygen to the blood. So life support chain. So it's the interaction of the respiratory system and the cardiopulmonary system. It includes perfusion, which are the cells oxygenated, and carbon dioxide removed. Okay, the lymphatic system is much like the cardiovascular system, in that you've got vessels that carry lymphatic fluid to the various different parts of the body. Okay, and it captures fluid and it maintains a balance of fluid. Lymphoid organs include the adenoids, the tonsils, the spleen, the thymus, and nodes. Okay, so we want to avoid taking a blood pressure on the side of a woman's body where a mastectomy was performed, just because of the fact that if we do, we're putting on a blood pressure cuff and tightening that arm, or squeezing all of that lymphatic vessels that run through the body, and those lymphatic vessels will then kind of back up and create nodules, and can cause some problems. So the nervous system, okay, the nervous system works like it runs along with the arteries and the veins and all of that, and it contains the nerves that go back up into the brain, to the spinal cord, to the brain, and feeds the brain information. Okay, so you've got your central nervous system that includes your brain and your spinal cord. You've got a peripheral nervous system, which are sensory nerves and motor nerves, and then you've got your autonomic nervous system, and those are your involuntary motor functions. Okay, so your digestive system, this provides the mechanisms by which food travels through the body and is digested. It consists of the stomach, the small intestine, the large intestine. You've got your accessory organs as well, your liver, your gallbladder, your pancreas, your spleen, your appendix. All of these accessory muscles or organs do something to aid in digestion and the gastrointestinal system. Okay, so the integumentary system, it functions for protection, water balance, temperature regulation, excretion, and shock or impact absorption. Okay, there's layers of the integumentary system. We've got the epidermis, which is the outermost layer, your dermis, and your subcutaneous, which is your innermost layer. Okay, so we've got our epidermis here, we've got our dermis here, the subcutaneous layer. Okay, so you've got, if you look, you've got all of these things. You've got your nerves here, you've got your arteries, which are the red, the veins, which are the blue. Okay, they're all intertwined. They all go in together. All right, and then you've got your sebaceous layer or your sweat glands right here. So the endocrine system, this system produces hormones that regulate many of the body activities and functions. It includes the pancreas and the adrenal glands, which secrete epinephrine. Okay, so the endocrine system, pituitary glands, thymus gland, your ovaries are included, your testes, your pancreas, the adrenal gland, all of those things, and they secrete hormones, chemicals in the body, and various things. Your renal system, or otherwise known as your urinary system, it helps the body regulate fluids, filter chemicals, and adjusts body pH. Your kidneys are your principal organs. The bladder is the fluid reservoir for urine. Okay, so again, what goes into the renal system is the kidneys, the ureters, your urinary bladder, the male urethra, and the female urethra. So ureters transport urine to the bladder from the kidneys, and urethra excretes the urine from the bladder to the external environment, to the toilet. Okay, our reproductive system, the female reproductive system includes the ovaries, the uterus, and the vagina. All right, it also includes the breasts, which produce milk, the fallopian tubes here, that transport the ovum to the uterus, the ovaries, which produce the ova, the vulva, which protects the vaginal orifice, and then your vagina. The male reproductive system includes the testes and the penis. So we've got the testes, the epididyma, which stores the sperm right up here. Okay. Your vas deferens, which transports the sperm to the urethra. And then the seminal vesicles, which secretes fluid for semen. And then the prostate gland, which secretes the fluid for semen. You've got your penis over here, which delivers the semen during intercourse. Okay. All right, so chapter review. So as an EMT, your knowledge of the anatomy or structure and the functions or physiology of the body will be important in allowing you to assess your patient and communicate your findings with other EMS personnel and hospital staff accurately and efficiently. Major body systems with which you should be familiar: the musculoskeletal system, the respiratory, cardiovascular, nervous system, digestive system, integumentary, endocrine, renal systems, reproductive systems. You got to know it all, because everything that we do, you don't have to know it on a cellular level, or even at an anatomy and physiology, college anatomy and physiology level, but you have to have some idea of how it all works together and gets formed together. Okay. All right, so let's think about this. You are treating a patient who was recently released from the intensive care unit with a massive infection, sepsis. Okay. This has impaired the patient's ability to regulate the size of the blood vessels. How might this affect the patient's ability to compensate for any additional illnesses? And what steps should you take to help this patient compensate? Okay. So this patient's sepsis will affect the body's ability to dilate and constrict the blood vessels, thereby decreasing its ability to regulate blood pressure. Okay. So our care for shock would be to include oxygen, warmth, because these patients will get cold, and a position of comfort. Okay. And then ALS should be considered as well. All right. If you guys have any questions, again, this was more of an overview of anatomy and physiology. I know I got into it a little bit deeper in some of the areas, but I want you guys to understand that this was not meant to be like a full in-depth anatomy and physiology. It's one chapter in your book. You've got to know it. When we talk about the other systems, we'll review those specific systems and go a little bit deeper, but we won't go a whole lot in depth into those systems. I encourage you to do the Crash Course Anatomy. Do all of those videos. There's about 40 of them. If you haven't done them already, I would do them because of the fact that it's great information. It goes into a little bit more in depth. He talks about it. He's great. They're about 20 minutes long for each of those videos. I think at most, some of them are like 3 to 4 minutes, but watch those videos and just be a little bit more advanced in your knowledge of anatomy and physiology than most. So if you have any questions, you can email me, call me, text me, let me know. I'll answer those questions for you. Don't hesitate to do that, okay? I will see you in the next lecture.